Hi, everybody, and welcome to From This Corner TV. I'm your host, Marilyn Dayton. And as usual, we've got a great guest with some wonderful information, and we're happy you could join us. Tonight we have with us Kathleeen Poole. Now, she is an expert in acupuncture and Chinese herbs. Now, let me just read this so I get it correct, okay? Kate received her BS in biology from the University of South Carolina. I love it down there. Love the Carolinas. And you've always been interested in science, which we'll come back to in a second. But you became fascinated with, you had an acupuncture treatment, and then you became fascinated with Chinese medicine. We're going to talk more about this, but what I want you to know is that happy anniversary, 25 years.
Yes, this month. Yep.
Isn't that amazing? To be, number one, a business owner. Number two, offering these services that you offer. It's, and I've received these services over time. Especially in the winter, I get your Chinese herbs, so I'm all prepared.
Right.
And I threw my back out once and went crying to her, hobbling in the door.
Oh, I try to be accommodating in those situations too. You can call me anytime.
And she does. So, tell me, now you've always been interested.
Let me tell you the best part of that.
Oh.
That it's been 25 years and I am not bored. I still, like, I've been doing something that long and I'm not bored. It's great.
You know, that's amazing when you've been doing it for so long.
I never
and
imagined
it still sparks you.
I'd be doing the same thing and it would, yeah, it does. It really does. I love it.
But don't you also make sure that you're up to date on...
Yes. I mean, I incorporate the learning the things I need to learn or want to learn with things I enjoy doing. Like, I love travel, so I tend to choose classes that maybe I have to travel to an interesting place to take, or, you know, that kind of thing. So I'm well aware of the burnout factor, and I've worked hard to prevent that fairly successfully in my career. So
where did you travel? China,
I went to China about 15 or 16 years ago. I went to Tanzania, and I taught there.
Ooh.
And then I went to China in 2008, was it, or 2007? To learn. I was there for a month studying.
Oh, wow.
But even within my own country, I mean, I took a week-long class in New Orleans one time, and I've traveled. Like, I mean, it's given me the chance to see my country as well as other parts of the world. It's been really great.
And you know, that's kind of cool when you've got a job that you can travel and help people, you know, teach people, as well as learn more yourself, and still be sparked by the whole thing 25 years later.
The part that I like.
Now, weren't you the first, let me see here, I've got, you were the first acupuncturist in the area?
Well, I wasn't the first acupuncturist in the area. There was somebody who I heard is back here, and his name's Guy Fatone, who has been around far longer than I have. I'm not quite sure where he is right now. And then there was somebody named Dove Camp who preceded me. And there were a couple of other, Dr. Lee, there were a couple of other Chinese acupuncturists or herbalists here on occasion here and there. But mine was the first really setting up clinic with kind of a full range of services, and that ran it like a business where it's like, yes, I love doing this acupuncture, but it's a business. I have a shop. I'm open kind of thing, and offering a full range of what Chinese medicine can do. So it's the first one in southeastern Connecticut that I know of. You know, that's done that.
And you do more than, let's see, you do, I've got some notes here, you offer Chinese herbs, acupuncture, therapeutic massage.
Yes.
And NAET.
Oh, that's a funny thing. That's a Nambudripod's allergy elimination technique. And that one, I don't advertise that one so much, I guess, because I'm really an acupuncturist herbalist, but that's an allergy elimination technique. A lot of people with environmental allergies or weird food allergies that they've tried everything for, nothing's worked, they'll try this. And it's based on kinesiology. It's one of these systems where you hold the allergen in your hand, and then there's a way of muscle testing to see how allergic you are to it. And then there's a protocol that you use with acupressure while the person's holding the substance, and then they avoid it for 24 hours. And I have 2 or 3 patients right now who I'm doing that for, but it's not the bulk of my practice.
No, but
it
it's
is
kind of
rather
interesting.
I mean, it's the
Yeah.
kind of thing that takes medicine to a different level. And it's like acupuncture. When I first went into acupuncture, it was pretty much illegal, and it was sort of like in the woo-woo group of therapies. The NAET, like in California, everybody knows what it is, but it's slowly been working its way over to the East Coast. So people who find me for that are pretty much looking for that.
Ah, okay.
Yeah.
Well, that's kind of interesting.
Yeah, it's
Yeah.
it's really fascinating. I've had some pretty interesting
And you get
experiences with it.
you get results.
I get
pretty
results, and what's nice is one of the reasons I went into it, and I figured this has to be a good karmic reason for going into it because I really had no interest in it. A friend needed this, and he was in the health profession too, and he kind of talked me into going and getting the training. I'm thinking, okay, I'll go do that because people have to schlep all the way to Bridgeport right now to get this, or to Boston. So somebody will be local. So I went, and I quickly realized that while I enjoyed doing it, it wasn't my first love. So what I did was I got all the classes for being able to treat people with the basic things. So even if they need a lot of care, right now they can come and get the basic ones from me, and then they can go for the advanced treatments to another place. And it saves them on the travel. And the way this particular system works, you don't have to get a new intake each time you go. So you would just go, I keep track of what I do. They go to the advanced practitioner for that with their notes from me, if they even need to. Usually the basics are enough and you don't need to do that. So even with that, when I was learning it, I'm thinking, okay, I really love doing this. How do I incorporate it into my practice? And I realized the way I incorporate it is become very good at doing the basic NAET, but I knew it was someone else would do the more advanced, because I like keeping my office full of acupuncture patients.
So let's talk a little bit about acupuncture. You know, some people say, oh, they're going to stick a needle in me, and they get a little scared. You don't really even feel it. At least I've never really felt it.
I brought needles so I could show people how thin they are. The thing is, people are afraid of if it hurts.
Yeah, exactly.
And what I've discovered is when they ask if it hurts, they don't really mean does it hurt. They mean, oh, does it feel like a needle?
Yeah, exactly.
It
like
doesn't
a shot.
feel. It should not feel like a needle.
Okay.
You're going to feel tingling maybe or heaviness, and I don't know what your experience of it was.
Tingle.
Or you
Some
might
of 'em I
feel a
didn't even
mild
feel.
electric shock that's very instantaneous and momentary. You might feel itchiness around the point. When I insert the needle, you might feel like a pop or like a muscle twitching. So if you're not expecting those things, you'll experience them as pain. But if you know ahead of time that no, it's not going to feel like a needle, it's not a hypodermic, it's not like a sewing needle, you want the sensation because you want to know the needle has engaged and it's doing something active in your body. So you'll want a little sensation of something.
I would think so.
So that's how I explain it. Like I don't talk in terms of does it hurt or not hurt. It's no, there are sensations, and no, it doesn't feel like a needle. And yes, I'm going to want you to feel a little something. But a lot of people like the way it feels. You know, they don't mind the insertion so much. So anyway, here's this is a single pack. I use these when I make house calls when I travel. I always have these in my purse. They're very sterile because they're single packs. In my office, I have packages with 10 and a little tube, so you know it's more clinical. But it comes in this tube, so how should I do this so it can be visible?
Yeah. Here, I'll hold
So that big thing you're seeing is the tube, and it's stuck to it. And you loosen it, and here's the needle. And the red part is the handle.
You can't
Can
even
you
see
it?
the
You can't
needle.
even see it on the.
You
there,
can see the
I got
sparkle,
the
a little bit of
shining,
sparkle.
yeah.
But the shiny
It's so
sparkle
tiny.
is bigger than the needle. The needle is
And
so tiny. It's
And
like a
let me-
hair.
Let me just show how it goes in. I'll take another one, and I can do you or I can do me. I'm not going to do a treatment, so I'll just do it on
No,
me.
I know.
So this is a nice point for this point's a really nice point for a lot of different things, and it's something safe to do if it's not part of a treatment. So you take the needle, and you just line the tube up. So the needle itself stands proud of the tube. That's kind of a technical term. The needle's taller than the tube. And then you just pop it in, and there you go.
Oh.
That's it. So using a tube, you get it past the skin without even feeling it. So that's not
Yeah.
even the part you feel. Then you take it and you manipulate it one way or the other.
Mm-hmm.
So one direction means one thing, another means another, how deep it goes depending on what part of the body with the flow of chi against. So there's all manner of ways you can manipulate it to get the result you want once it's in.
And
So
it's,
that's it.
and it's as thin as a hair.
It's
Trust
so
me.
thin.
Yeah, it is. And I
And
know.
no blood.
Yeah, absolutely.
It's like,
But yet
and
it's
I've
so
got a sharps
effective.
container with me here.
When I left her office after she worked on my back, I could actually walk. I mean, I was a little stiff, but I could walk rather than being hunched over like this little old lady. You know, it
Yeah.
just, it helped.
And then
so
I have this like
immensely.
portable sharps container because you would never throw these out in the
Oh,
trash.
no, that's for sure. Yeah. So let's talk a little bit about the history of acupuncture.
Oh, acupuncture is thousands of years old. They have found bone needles in ancient graves. Now, those were probably used for acupressure, but the meridian system has been complete for thousands of years, like people have known about it. And the textbooks that I study from are 2,000 years old, so that means 2,000 years ago, there were books that were fully written, that were complete. So that means before that, it had to have been practiced. And how it came about, people, I mean, there's a lot of controversy about how it may have come about. There's all kinds of theories about how they figured out the system. And I mean, some people even think it was one of these channeled, like given divine inspiration sort of things. And it's so old, I don't even know where to begin to say how it started.
But it started in China.
Yes, it
Yes?
started in China, quickly moved to all the other Asian countries, pretty much like Korea. My tradition was originally French Vietnamese,
Oh.
because Vietnam, a lot of the acupuncturists immigrated to France during wartime, and so French Vietnamese acupuncture is kind of like a style, and that's what I was originally trained in. Since then, I've learned Japanese acupuncture. I studied with Kiko Matsumoto, who's a pretty famous Japanese acupuncturist. I studied with her in school and then for many years after school. And there's Korean acupuncture. There's a special hand acupuncture technique that I don't personally know or do, but there's a system of doing hand acupuncture, and that the Koreans are kind of famous for that. So every country or ethnic group has adapted the original acupuncture and the system of qi in the body. I always think everybody knows what that means, but I should explain a little bit about what that is.
Yeah.
So just like you have blood vessels flowing through your body, coursing through with like blood, bringing nutrients everywhere, and you have a lymphatic drainage system with fluids and that, you have another system in your body with meridians, it's called. Instead of blood vessels, you have meridians, which are energy vessels. And we call it qi. In Japan, they call it ki. And those vessels run everywhere through your body alongside the blood vessels. So what you do with the needle is you engage that energy. You're inserting the needle into that meridian, into that channel, that little river of energy, and you're engaging the flow. And basically, in a nutshell, acupuncture is just keeping that flow going.
So it's
I mean,
not.
it's more complicated than that. But
So
that's
it's not.
basically.
I had heard that if you've got pain, that acupuncture can block the pain from being received, or
Well,
something
that's
like
a
that.
Western
or is-
explanation for acupuncture, and I'm
Probably.
not saying that's wrong.
Yeah.
But if you go to Western, like by Western I mean like regular doctors, regular journals,
Western style.
they're going to talk about endorphin release and pain blocking, and yes, it's known that endorphins are released, serotonin, like chemicals in your brain, and I don't understand quite what they're talking about by pain blocking, but there's some kind of nerve thing that happens with acupuncture, and because I'm very traditional with my medicine and I want to practice it according to the theories that was practiced, like I feel our strength is those ancient theories. So for me, I don't really investigate how those Western explanations work, but they are true. Many things can be true at once. But the way acupuncture really works has to be seen in its own history. And so the way it works is, we would say if you have pain, what's happening is something has blocked the energy and it's all flowing. So if you think of like a stream that gets dammed up, like a beaver builds a dam across the stream, and then all the water kind of collects, and all the leaves collect there, and it's all like stuck. And everything gets swollen, and you get pain and inflammation. So what the acupuncture does, it's like it's breaking up that
dam?
That dam.
Oh, cool.
And all the chi starts flowing. And then if you go to somebody who's an acupuncturist, they're going to know, anybody can stick needles in where it hurts. But an acupuncturist is going to know up and downstream where to do little unblocking, or sometimes, like today, I had somebody come in who had back pain in her lower back. So I was breaking up the chi in the back, but then in her leg, I was doing this pulling the chi down, just kind of making it come down in a way. So we're not blocking the pain, we're making the energy flow properly so it can pull away inflammation, and it works. It really works. About acupuncturists. Acupuncture is a profession, but it's also a technique, and there are chiropractors and medical doctors who do acupuncture, and they're very good at what they do, but it's not the same as being an acupuncturist who went for 3 years of school. Now, I refer to one of the local doctors who does acupuncture. A lot of times, if the insurance won't cover it from me, I'll send them to him, and he's got a good reputation for it. But and chiropractors will do it too, but I mean, for a chiropractor to be doing acupuncture after only having a few weekends of training is like me knowing a few adjustments. It's not that I'm bad at them, but I'm not a chiropractor.
Yeah.
So like to go to an acupuncturist, if you have anything complicated, is always the best.
What are some of the complications that you have helped people get past or heal from?
You said to think of some interesting cases, so I thought of
Yeah.
one was it helps emotional things as well as pain. And postpartum depression is a really big problem. And so I've had at least one person, well, more than one person, but I'll make a composite of different people into the story, came because she had been depressed for a long time since the birth of her child, and was really afraid because she was going to want to have another child. And it was to the point where she had been in and out of different kinds of treatment centers. And I ascertained that the depression had something to do with her menstrual cycle. So my guess is that this happened way before the babies. And by adjusting the emotional energy, within like one period, she was taking less medicine. She wasn't really afraid of this happening again when she had another baby. And her whole life is just better, and she doesn't have to be on heavy medication anymore. Now, yeah, maybe these people who have problems, and I had that experience also with it's not just women who suffer, but I had a similar male client, a man who came in with, obviously not related to his cycle and his babies, but people get depressed, whether they're male or female.
Oh, yeah.
And
yeah.
this other person, this guy, he's just taking like these little, we sell these little bottles of pills. He's just taking little bottles of pills now for $10 a bottle.
Oh, wow.
And he keeps his psychiatric medicine on hand. He may need it again. I can't make any guarantees, but it's way better to go through life with herbs. And we started out with acupuncture, usually for depression or anxiety. And one of my specialties is anxiety. I start people out with acupuncture because I feel I can get immediate results, but they may not be as long lasting. So we start out with 4 or 5 acupunctures, and then we do an herbal evaluation, and then we get a combination, and then we try to wean off the acupuncture. And I tease my patients, and I say, if I'm doing my job, I'm out of business, right?
Yeah,
because
okay.
you're going to get better, and you're not going to need me. So obviously they refer. I'm still in business, but the idea of my acupuncture is to make it so you don't need acupuncture. So if I can get somebody on herbs that they can take, then they can just call me up whenever they need a boost. Or maybe like around Christmas time, somebody who has depression, that might be their time. So that. You take your herbs, you call me up in November, we do some treatments, you call as needed. Or another big one is children getting married. Oh, that was another interesting case I had. I had this woman come in, and this was like 10 or 15 years ago. She just cried easy, like really cries, and I forget whether it was her son or her daughter was getting married, and she was going there, and I think it might have been the first child to get married, and she was just like, oh, is there anything you could do to keep me from crying? Because all her makeup would get, and she wouldn't be able to stop. And I did this treatment. I don't even remember exactly what it was. Treated her twice. She went off to the wedding, and she came back, and I said, did you cry? She goes, yes. She says, I just cried the right amount. You want to have someone cry a little bit. So it's really good for emotional type stuff too. Now, pain type things, what's really wonderful is sometimes it can get somebody just over the hump enough so the other therapies work better. Mm-hmm. So somebody's getting massage or physical therapy or something like that, or chiropractic, and then it's at a plateau, and if they get the acupuncture, it kind of gets them over the hump so they can have, it's always good to have more than one thing be able to help you, because what if you call your acupuncturist, they're out of town? Well, it's nice to have a massage therapist. So it helps people be able to use therapies better. And we think of managing and making people's lives better and relieving suffering more than we think of cure.
So you actually complement other services like chiropractic and physical therapy and that kind of thing.
I think so. I think they're great to work with.
Yeah.
And psychotherapists, obviously, if I'm
Obviously, yeah, with the emotional. I never would have thought that acupuncture could help emotional situations.
It's great for that. And also, I have somebody who's, doesn't come anymore, but he's a playwright. And he used to come when he had writer's block.
Oh my goodness.
And I mean, I can't magically make writer's block go away, but the energy of the liver channel, the liver's in charge of creativity. And when you get a blockage like that, it usually means your liver chi is stuck. So you come and I work on your liver chi, and your heart holds memory and mental processes. So I work on like liver heart energy. And it would always work to help get him back.
So you're saying that creativity comes from our liver?
No, I'm saying that the creativity is the custodian. I mean, the liver is the custodian of our creativity.
Oh.
So who knows where creativity comes from? But the liver is the custodian of making our creativity work well.
Oh.
And it's also the custodian of planning. So that kind of goes together.
Yeah, it does.
Yeah.
So if I'm creating something for somebody, and I'm having difficulty getting beyond this spot, the blank piece of paper.
Yep.
And I can't even plan when I'm going to do it or how I'm going to do it, then that means that I've got a little blockage going on around the liver.
It could be around the liver. I mean, there are other organs it could be, but that would be the first place I'd look.
That's interesting.
Yeah.
So what other organs do you sometimes
Well, the really
deal
common
with?
ones culturally for us are liver, because it's in charge of creativity, and it's also in charge of the smooth flow of emotional energy. And we live in such stressful, frustrating culture. Like both parents are working, and the kids are doing this, and there's all the family gatherings, and it's just hard. So everything gets stuck and frustrated.
Yes.
So the liver is a real major meridian that I look at on almost everybody. No matter what's wrong, I will assess that just as stress, modern day stress.
Because we're all stressed.
Yeah. And the other one is the spleen. In Chinese medicine, the spleen function is more like the pancreas. And we say the spleen is in charge of all digestion. So it's like the spleen is the captain in charge of your large intestine and your small intestine, your stomach, and making all that work. And emotionally, the spleen is being rooted like in earth, but it's also worry in a different way than the liver. Like the kind of worry the spleen has is mulling things over. You can't stop thinking about something. Like a real extreme spleen condition would be like obsessive compulsive disorder.
Oh.
And also the spleen, because it's in charge of digestion, it has a lot to do with irritable bowel syndrome and motion sickness. I just treated someone for motion sickness this week. And even little kids who eat too much ice cream, like it's their spleen has to be helped because it gets all soggy and so that's the other organ that often I treat.
Now, who would have thought of that? It's really kind of interesting, and I know there's a lot more.
Oh,
but
no, this one.
Okay.
Anyone who has menstrual problems, PMS, is the only thing. I mean, that's up there in the top 10, top
Oh,
5.
really?
Yeah, it's
Wow.
really, really, really good for that.
Well,
Including the emotional and the physical discomfort of it. And it's not normal to have those kinds of symptoms, but it's considered normal in our medical society. And it's
Yeah.
not normal. So that's something that I would encourage anyone, if you know anyone who goes kind of
those
emotional
kind of
around their
problems.
periods,
Make
to
sure
come in,
you
call me.
write down that phone number that
Yeah.
that we'll be putting up from time to time. One last thing before we take the break. You have a clinic that makes it affordable for people to come to you.
Yes, because a first visit of acupuncture in my office, and I'm median, because there's higher people than this, and there's lower, is $135. You're there for an hour, 15 minutes, an hour and a half, lots of talking, a good treatment. Follow-ups will be $105, maybe $85 if I can cut some corners.
Which is hard for some people.
Yeah, I mean, a
It
lot of
really
people can't
is,
afford that, but
yeah.
other people can't. A lot of insurance covers it, but a lot of insurance doesn't.
Yes,
So,
true.
you know, it's pretty much out of pocket for most people. So I started a clinic 3 years ago called a community acupuncture clinic. Mine is more like you'd say it's a hybrid because I don't have room for a true community clinic. But it's less private. So a real community clinic is a big room like this here,
Right.
with chairs, just easy chairs or recliner chairs in a circle. And then there's a little table next to each chair, and the acupuncturist comes around and you like does everybody quick.
Right.
And it's sliding scale. So I can't do that, I don't have room. So what I do is I just use my treatment rooms. I leave the doors open, ajar, not fully, and I set the tables up so they're reclining, and you don't get undressed, you take your shoes and socks off, roll up your pants legs, so that saves time. And it's pretty much, I focus on something, like it's not a big involved, but allergies, it's great for allergies, the community clinic. For some of these depressions, once you're better, it's a good way to maintain them. Menstrual disorders, some kinds of pain are really easily treated in community acupuncture.
Wow.
And my sliding scale on that is, the first visit is 55, but the sliding scale is 35 to 50.
Which
I
makes
do
it a
that
lot
2
more
days a week, yeah.
And that's, you know, giving back to the community, knowing that people need this kind of
Yeah.
help.
And it also makes, I had someone come in with Bell's palsy, and there's no medical treatment for that really.
No.
And he was able to come, and you need to treat that frequently if you want it to work. So by having him come to the community clinic, I was able to see him twice a week for less than a regular treatment would have cost.
Wow. And it helped, of
It
course
helped a lot, yeah.
Because really with that, all you can do is wait until it
Yeah.
goes away, which it does. Okay, we are going to take a little break, and when we come back, we're going to explain our little show and tell here. We're going to talk about Chinese herbs, and you'll learn a few more things. So we'll be back in just a couple minutes.
Thank you.
Can you help me with this? My new dad teaches me all kinds of stuff.
Sure.
He helps me with homework.
That would be 3.6795.
Thanks.
Yep.
He helps me with my decision making.
I wouldn't use this one. Ever.
And he's even teaching me how to drive.
And that's why cars have bumpers.
I'm learning so much.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are. When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Up, college is hard. Down, those books are heavy.
My sport is football, but my passion is education. So every year I take promising high schoolers on a college tour to show them that higher education means a brighter future. My name is Nnamdi Asamoah. I don't just wear the shirt, I live it.
You can be a reader, tutor, or mentor too. Take the pledge at liveunited.org/volunteer.
Do you wear this?
Hi, we're back to From This Corner TV, and we're laughing because I asked about something that I understood that she does with her acupuncture, our special guest Kate Poole, and that is what I call the facelift. Let's talk about that for a moment.
We
before
like to
move
call
on.
it facial rejuvenation because obviously I can't do as good a job as a real facelift person who will like lift her face. But people want to look good. It's not that they want their faces to be tight, you know. And acupuncture is called facial rejuvenation acupuncture, and it really helps with wrinkles, a lot with wrinkles. It can help tone and like jowls, and like it's not going to miraculously make it disappear, but friends notice when you get a few treatments. People will get commented on, and I have been having a really good time in my office lately because I've discovered that I can actually do these facial rejuvenation treatments in the community acupuncture clinic.
Oh.
And usually cosmetic of anything costs more, and I can do it for less. And I feel like regular women should be able to feel and look good about themselves, so why should it cost $200 to go and do something like that or whatever? I don't know how much it costs in other places.
But it costs a lot.
I mean, if you went to the Norwich Inn and Spa, you'd be paying something for it.
You would,
And
definitely.
it's just so easy to do. And so I'll do it for a little bit more of a surcharge in a regular acupuncture treatment, but I can do it in the community clinic, which
is very
surprised me. I
cool.
never tried it before, and it's working great.
Because it doesn't matter who you are or how much you can afford. If you want to look better,
Yeah.
why not?
It's simple and easy, and it doesn't take that much time in the community acupuncture clinic. It's a half an hour.
Wow.
So stop by on a Saturday, and out you go.
Is that when you have your clinic?
I have
on
them on
Saturdays?
Thursday afternoons and on Saturday mornings. I say Thursday afternoon and most Saturdays because I'm away sometimes on the weekend.
Yeah.
So,
Well,
yeah.
some people do go away on the weekends. That's okay. That's okay.
I'm not sure whether I should be looking at you or looking over there.
Well, you can look wherever you want to.
Okay.
I look all over the place when I'm
All right.
talking.
Okay.
So, and there's a lot more about acupuncture that you can learn. You can always go to Kate's website.
I do have a very informational website.
Yes, you do.
Yeah.
You really do. And so if you've got some, and there it is.
Oh,
And there's also your phone number if you're interested in finding out more about Kate helping you with either your face or anything else. But the other thing about you is, and it's fascinating to me, these Chinese herbs.
Oh, that surprised me. When I got out of acupuncture school, I had no interest in herbs whatsoever. I went to acupuncture school for 3 years. They got my degree in that. And then about 10 years later, I got interested in herbs, and I went back for another 3 years, and I got my herbal diploma. So I have like dual training instead of 4 years acupuncture and herbs. I've got 3 of each, so it's in depth. But I started realizing that sometimes the acupuncture wasn't doing enough, and I started playing with herbs, and I could see that there was a big difference, like it would enhance treatments, and that was when I got interested, and I was self-taught for part of it. I finally went and got some serious training, where I have a diploma, and I've got past the national board exam, and that with the herbs. And I went to China to study a few years ago, and I've been continuing to study with that person, Dr. Huang, almost every year since for at least a week. So,
Wow.
Yeah.
So what is it about, now Chinese herbs, of course, have been around for thousands of years
Right,
too.
as have any kind of herbs.
Yes,
You know, but
yes. So you've got a little bit of show and tell
I
here.
do.
So
Well,
let's
here,
talk a little bit
let's
about
take-
these
well,
to start.
One thing I love to do is have things that are relevant to the season, and I don't know if this is going to be on YouTube, so it may not be seasonal, but it is high summer now. And so I brought some things that you might want in the summer. This is a really nice poison ivy wash.
And that, I
You can
I
boil
saw
this
that
up.
on the table, and I thought,
Yes.
wow.
It's only got 4 herbs in it. They're especially Chinese herbs. Each of the herbs has a different thing it does, but they are all oriented towards skin. They're oriented towards drying up, like oozing poison ivy. You know, it's like
Yeah, oh,
ugh.
it's-
And even if you only have the rashy part, these herbs will cool it. And because they're good for healing skin, they don't just take care of the symptoms, they promote the healing of the skin.
Then that would
They
be
make you
good
feel
for
better.
like shingles too, wouldn't it?
Actually,
Sort of, or
I
not?
haven't tried this for shingles, but that's an interesting idea.
Because those are very similar. You know,
That's
the
right.
rash, and then it becomes open sores, just like poison ivy
I
does.
treat a lot of shingles with acupuncture,
Mm-hmm.
and you have just given me the idea to try this. Yes, because it would be, because we don't care the name of the disease, we care what it looks like in the body. And shingles does look a lot like the poison ivy pustules, and that would be something kind of interesting to do.
Yeah.
And what you could do is you could make this up, you boil this up, and then you drain the liquid off, and that's what you use, and you throw the herbs away. What you could do is you could have like a spritzer bottle. Because it's going to be hard to wash the shingles area,
Yeah,
right?
I was-
But you have
yeah.
a spritzer bottle, and you could spritz the shingles area.
Oh, yeah. That
So
would be
that's another
great.
thing. There's these inventive ways. You have to have an inventive way of thinking to practice Chinese medicine.
Well, I've
Learn
had
how to
shingles, so
apply.
that's why I was thinking about
Yeah.
it.
Oh,
so.
another thing. If you know anyone who has shingles, get them to an acupuncturist ASAP.
Okay.
Yeah.
Okay.
It won't cure it, but it's going to help it pass through quicker and reduce the pain.
Oh, that's good to know.
So,
Good
so
to
anyway,
know.
that's one thing.
That is
And then
cool.
we sell these little each season we try to have a kit that makes everything's really affordable. So
yeah.
this is like a $20 summer survival kit, we call it. And it has one of these, this one. This is great for sinuses. And we have one that's really good for like motion sickness or overeating or too much greasy food on the grill. And we put a bug spray that made out of essential oils that my receptionist Cassandra made. She studied Western herbs. So she puts together these things from time to time. And then, what no kitchen, and you should never go camping without this, the amazing burn cream.
Ooh.
This stuff is like, and it's $3, it's $3.50. And that's, I mean, you might get it cheaper.
And it
somewhere,
lasts
but yeah.
a while.
So
looks
these
like.
things, I'm showing you things that are really affordable and inexpensive that it wouldn't be, you could keep in your camping kit or your car.
your
I never
backpack,
went
I think.
anywhere without these when I was traveling with my kids. These are like motion sickness pills. And they work on the spleen. Remember we were talking about the
we
spleen?
were talking about the
Yeah, you would do that. So these are just things. These are also something I would never go without Yunnan Baiyao pills. And what's interesting about these, they give these to animals, and I am all the time having people call up and tell me that their vet ran out of the Yunnan Baiyao, and the vet said to call my out because people know that I have a good pharmacy. So they call up and they come and get these for their dogs. These
my
are for
goodness.
dogs. They use these for dogs who are really sick, though, who have like bleeding tumors and things like that. That's not what we use them for people. But they're anti-bruising pills, and there's a thing called HIT medicine in Chinese medicine that's related to martial arts. So, you know, martial arts, you're always getting beat up.
Geez, yeah.
There's a whole segment of Chinese medicine devoted to patching people up for martial arts. And so this is one of those things. If you fall like off a ladder, or if you get hit by a baseball, or if you come home from surgery and you're bruised or whatever, you take these pills just for a day or two. They're like arnica. Some people will know what arnica is.
Yes.
The Western herb arnica. So these are, I mean, again, these are pills that may be hard to get anywhere else. Like health food stores don't really carry them. Chinese medicine is particular. So, I mean, I brought some of these just because it's the season to show people what they could do. And then I also brought, herbs can be food herbs. And these are very popular now. People are eating these. They're called Gucci berries or lysine seed berries, or wolfberry, I think is the other name. Sometimes I forget the English. And they're these little red berries, and you can try some. People eat them like raisins.
Are
I will
they-
put them, yeah, just
put 'em right here.
Just put
Yeah.
them right here, and we'll eat a couple.
Are
And you
they,
eat them like raisins, or what's really nice, no, they're chewy like raisins.
Oh.
And what you can do is, you can put them in, they're sweet. You can put them in a little, like you take like a tea ball, and you can maybe take a tablespoon, throw them in the bottom of a cup, pour boiling water on them, and you get this lovely the tasting tea. And then when you're finished making the tea, you can eat the berries. It's really fun.
That
These are said to brighten the eyes.
Ah.
So like phytophobia, like when you have like light, when you're sensitive to light, or fatigue, or even just any kind of eyesight problem. These are very good because that liver organ we were talking about, it's responsible for creativity and vision, like vision in the physical sense and vision of planning we talked about. So these are said to brighten the eyes, and the reason they do that is they benefit, we would say, our terminology would be they benefit the liver. So I can throw them in formulas, and what's great is they are sweet, so kids like them.
They're very good.
They're really nice.
They're really good. I'm going to have another.
And you can get them in health food stores. They sell them in little packets in health food stores. People buy them. So I just wanted to demonstrate how herbs, they're originally foods. And a lot of the herbs I use, like astragalus, that's very popular. It sort of looks like a tongue depressor. It's like a piece of bark that's been sliced. It's sweet. It benefits the digestion, the stomach, and the spleen, and the lungs. So it's a nice thing to have at flu season. And you can just throw astragalus into your chicken soup, and it makes it taste really, really good. And it's not at the strength of being like a medicinal herb at that point, so you don't have to worry about side effects. It's just like another piece of food you're throwing in, like basil.
I was just thinking about basil, how, when we're making soup, we throw in, these things that we then take out because they're not meant to be.
Right, because the astragalus you would take out because it just doesn't taste good. And that's why in my office we teasingly call it the tongue depressor, because it looks like a tongue depressor and it tastes like you're chewing on a popsicle stick. But after the essence is all boiled out of it, you don't need to put it in the soup.
Now, the curious thing here is I'm used to taking herbs with my tea. I have one of the bowls and I put things in there, and then but the interesting thing about herbs that you eat like this is, now I get eye strain all the time because I'm forever in front of the computer doing design work, writing things, just all the time. And I have to remind myself to stop and eat, stop and, stretch and that kind of thing, because I get very stiff. But my eyes, by the evening, my eyes are all kind of bloodshot and they hurt and all that kind of stuff. So something like this would be really, really good.
Something like this, they're easy to get. I mean, you can buy them from me, or you can go to the health food store. I mean, probably Stop and Shop has them.
Oh, probably, yeah.
And you can put them in soups. I put them in my soups.
Yeah, that's really
Or you can put them in the teacup, or you can just chew on them. Just have them around.
Now, the interesting thing is, the last time I saw you was wintertime, and you were doing a workshop. And remember at Everything's Zen.
Was that the your holistic medicine cabinet, or was that the?
Well, it was one of the holistic health workshops.
It was the one about taking care of yourself in the winter, maybe.
Yeah, it was. Because I ended up getting two winter kits.
The winter warming workshop, I think we called it.
The winter warming, that was what it was.
Yeah, because you want warming in the winter. Yes.
And it was really interesting because you always come prepared. She always comes
I put
prepared.
a lot of effort into my presentations.
You do.
Yeah.
You really do. So that we walk out of there going, oh my God, that was so interesting. It's always, and I've seen you several times do workshops. And it's always fascinating, and you always have a plan that's seasonal or maybe built around some kind of subject matter or disease or something like that.
Right, yeah, like a topic. And I really enjoy putting things like this together, so I usually come to these things with like a package people can purchase very inexpensively for whatever we're talking about.
And then we walk out of there all set, and we know what, and you've got the sheet, the instruction sheet, so we know what to do.
And I enjoy doing those so much that actually I haven't really done it, I haven't really advertised it, but that's something I want to start adding as an offering that I do as a business, of doing this for people. Like if someone had a topic they wanted me to talk about, I could come and do this presentation. And like you said, I do put a lot of effort into it and bring things to show, like we just did here a little bit. I mean, I thought a lot about this too before I came.
Exactly.
Oh, and I bring handouts too, so people can remember what they learned, because who's going to remember what Yan Pian means?
I mean,
you're not going
we can't
to.
even pronounce it, let alone remember it.
I know. I tell my employees when they can pronounce the Chinese, which I can't pronounce properly either, that they get a raise.
Now, I've been in your place of business, and you've got this room that's like a dispensary.
Yes, that's exactly what it is.
It's almost like a
It's a
pharmaceutical.
It has walls and walls of herbs on them, and it has a big, lovely counter a friend of mine built for me. In the middle of it, this nice wooden counter we can work on and mix things up and grind. And yeah.
So when someone comes to you, say for instance they come to you for acupuncture, and you feel that an herb will also help them, and you take them right into the dispensary and you pull what you need off the shelves and put it together. And
I can do that, but what I prefer doing, because I feel they're two separate disciplines. So if someone comes for acupuncture and they need an herb, I'm more likely to give them something in a bottle like this that's off the shelf.
Okay.
And then if I think they need something more serious, they'll come in and I make it a very reasonable price for an herbal workup consultation.
Yeah.
And then I go into my pharmacy or my dispensary and I mix up whatever for them. But the reason I do that is because Chinese herbs are different. If you come in, say, with back pain, you're not going to get, oh, I have an herb for back pain, here, take this. In Chinese herbs, you have to think of the formula like it's almost like when you put 8 or 10 herbs together into a formula, it's a super herb. It becomes its own entity. So it's not astragalus and dongui and Gucci berries and shudi or whatever it is in there. Those 4 things or 8 things, they all combine and are cooked together and they become a different entity.
Oh.
So and that makes it very flexible, because if you came in with back pain and then one of the Franks came in with back pain, you might walk out with 2 different formulas even though you were diagnosed with the same thing by the doctor. Because there are the herbs for back pain, yes, but then that's half the formula, back pain. The other half of the formula is, why does Marilyn personally have back pain?
Yeah.
Like what's happening in her body that's allowing this back pain to exist? And that's the second half of the herbal formula.
Aha.
So that is where I have to do the interview and the workup, and then look at your tongue, and I poke your abdomen a little bit, and like I have these diagnostic techniques I use to discover why you are personally having this back pain when somebody else down the street isn't, but went through the same thing. So it's a very personable, very flexible, very exact medicine. And I don't feel I can be that exact if you just come in for acupuncture and I decide to give you herbs. Although there are plenty of herbs that can be given in that setting too. It's just to get the dispensary experience, you're probably going to need me to take a little bit more involved look.
So the thing that I'm kind of getting the difference between Chinese herbal medicine and Western style medicine is, a lot of Western style is to try to help you handle a situation rather than maybe digging a little bit deeper and treating the cause.
I think that may be true, but because I don't practice Western herbs, I don't know that. But Western herbs are more likely to be saying, this is for your headache, this is for your eye pain, this is for your, like, take St. John's wort if you're depressed. But in Chinese medicine, you would almost never give one herb. You'd always give a combination. But then on the other hand, as far as Western, I don't know, there could be some very, very experienced Western herbalists who do think of it differently. I mean, so I don't want to dismiss that, but I know the kind of herbal that you go into the CVS to get, or the kind of herbs you read about in the paper every day that are Western herbs, are what you're saying. They're dealing with symptoms.
Yeah.
They're not really getting underneath the underlying cause of why you are like that.
Yeah.
But I think if you went to a naturopath or a real herbalist who really knew what they were doing, probably they would.
Then they would start digging.
I would hope, but I mean, I don't do that kind of herbal, so I don't know.
Well, in my experience, I have found that I actually combine. I'm being treated right now by my GP, my Western style GP, who is open-minded, very supportive, and listens. And she's also working with my naturopath.
Excellent.
And then I also have a nutritionist that is now coming into play, so that we're trying to get rid of the inflammations
Right.
and the heavy metals and all of that.
Oh, right,
Okay.
yes.
And then we're going to rebuild me or build me back
Right.
up with proper nutrition. There's a lot of things you can do with nutrition. Eating the right kind of foods where it'll make you better for longer term and you'll be healthier.
Definitely. Yes.
And as you say, the Chinese herbs are food, basically.
Yes, you can use
So-
the food herbs. And you know what's really interesting, what you're saying about that is, if you came to me for whatever problem you're talking about, and you told me you were doing these things, you're working with a naturopath and you're doing the nutritionist, and I know these people and I know they're very good, I would probably say to you, why don't you keep doing those things? Don't bother about the Chinese herbs right now. You don't need another thing to go home and boil up. If that doesn't work, or when you're done with that course, come and we'll see if we can take it further. Because I feel like people, sometimes we do too many things in our attempt to get better. And sometimes I think if you're doing a system, you should stick to it. And that's when maybe I'll say, let's do acupuncture. Because I regularly tell people, no, let's not do the herbs now. I know that's why you're here. Let's do acupuncture because, you know, you're doing this and this and this, and I'm going to give you another bottle to open. You don't need another bottle to open every morning. You need to be, so I like to, sometimes my coordination with other modalities is me saying, oh, well, let's just not do this right now because you're doing enough. And your program seems to be working for you. Let's just let it work and see where we are, and then maybe we'll do the herbs. I'm very practical.
Yeah, and that makes sense.
Yeah.
And the interesting thing is that my regular GP and my naturopath communicate back and
I
forth.
love that, yes.
Which is amazing. It's
Yeah.
a gift. And my nutritionist is trying to coordinate with them and give me natural things like, for instance, probiotics. Okay,
Right.
instead of being on probiotics, I get it with my food, like kimchi.
Right,
and
yes, these
with,
fermented foods and the...
and beets. I love beets. And you can get beets in a glass jar. And I tell you, there's your. I never knew these things. She is just so good. But anyway, and we're doing it in phases.
Right.
You know, that you do the detox to get rid of the bad stuff. And then you, matter of fact, I'm on regular natural detox plus lymphatic detox.
Oh, that's really important
And
too.
then I'm going to do the liver detox after I'm done with these. And at that point, we're going to reevaluate and incorporate the, you know, I'm going to start incorporating the foods and stuff.
Yeah.
There is no cure-all out there for everybody and everything.
Right, that's the
Everybody's
other thing.
different.
No herb, there's these herbs go through, they're in vogues, like everybody was taking St. John's wort, everybody's taking astragalus. There is no herb that's good for everybody because, like we were saying, you are different than someone else, so why would the same herb be good for everyone?
Exactly.
Now, there may be herbs that won't hurt any, like they're not going to hurt you, but are they good for you? And you know, when you were talking about the detox, another valuable asset Chinese herbs can be, if you were doing all of those programs and you were having a really hard time with detox, that's when I might say to you, okay, let's do a little bit of Chinese medicine. But the focus of my Chinese medicine and my Chinese herbs wouldn't be to treat the problem those other people were treating. My focus would be, let's eliminate the side effects from those treatments for you so that you can go through those treatments better. Because there's this thing when you have the die-off reaction, like when you're treated for candida, there's this die-off of yeast and you start feeling sick. And usually you just go through that, but you could use the Chinese herbs to help with the side effects. So like with chemotherapy, I'm not treating cancer, but I'm helping you get through the chemo. But if you had come to me and said, you know, I have cancer, I don't want to do chemo, will you do herbs? I'm probably going to say, do your chemo. But I will say, well, let's use the herbs in this way to keep your immune system built up, to keep your bones from hurting, to keep you from being nauseous.
Which
So,
is wonderful.
yeah.
It's a great
It's
note
so
to finish it
versatile.
on, actually.
Okay.
Because we've only got a few minutes left.
Thank you so much
And-
for having
Oh,
me.
this has been
been really
wonderful.
fun.
Every time I see you, it's like I just go, wow. You know, I learn so much. And I love the show and tell bit.
I love show and tell.
Yes,
Yeah.
it's fun. I've actually got a couple of announcements that I'd like to make for upcoming events, which I always do towards the end of the show. And get out your calendars, please, and write these down, because we've got, first of all, the Shoreline Roller Derby. These, some of these girls have been on our show before. They're asking their fans to help fight hunger in the community, a wonderful thing to do. On July 26th, they will hold a double-header event called Summer Shovin' and a food drive to benefit the Gemma E. Moran Food Center. The doors will open at 5 p.m. on July 26th at the Galaxy Roller Rink in Groton, Connecticut. Pre-sold tickets are $10. At the door it's $12, or if you've got your military ID, it's $10. The second event, which I am proud to talk about, is the 57th Annual Mystic Outdoor Art Festival. We look forward to this every year. It's one of the oldest of its kind in the Northeast and one of the largest attended events here in southeastern Connecticut. They're usually between 4,000 and 5,000 people with 2 miles of vendors, would you believe? I've walked those 2 miles several times. With more than 100,000 works of art. The event's being held Saturday, August 9th, write that down, from 10 a.m. to 6 p.m. and Sunday, August 10th, from 10 a.m. to 5 p.m. More information on their website, mysticchamber.org, and also sign up to be a friend of the Outdoor Art Festival for $100. I did. Be a friend of the festival and help support it. That's a click away right on their website. And as always, when you've got ideas or events, please email me, and we'll get it on the show for you. Give us enough advanced warning, because our shows are live to tape, which means we go on later than we are taping. So we need a couple of weeks at least to get that information out there. Kate, this has been wonderful.
Oh, thank you so
much. It's like, okay, I'm going to have to make an appointment and go see her now.
Oh, no.
See? And thank you. Thank you for joining us today. And give her a call. See if she can help you with, we've all got something.
And you can walk to my office from the Galaxy Roller Rink.
Hey,
how about that?
How about that? That's a good one. Okay, and come and join us again next week. And we'll see you then.